Hi everybody and welcome back. Andrea Twarowski here with Dentalelle Tutoring. I'm excited to talk to you guys about, you must be excited that you are all new dental hygienists or new dental assistants who are about to work in a practice. You may have started already and that is okay, but there are certain things that you should know. I remember when I was a new graduate, I had a lot of questions and nobody could answer them. I don't know why, but people just couldn't take the time to answer my questions. So I am here to take the time to answer your questions because I know things can seem very overwhelming. Having a real live professional job for the first time can be very overwhelming and you want to do an excellent job. You're seeing people, you're seeing patients, so you need to know your stuff, but you also need to be nice. You need to be professional at the same time. So a lot of people come to me and say, oh my God, I'm starting my job on Monday or on Tuesday. Help. Like, should I be asking questions? Should I not be asking questions? Should I arrive early? Should I arrive not early? Like what types of questions or things should I be thinking about? So first and foremost, as silly as it sounds, please arrive early because if you haven't been to that location before, the traffic, there could be construction, you could have a hard time finding it, who knows, and you don't obviously want to show up late for your first day. Even I have been at the office for 12 years. I show up a half an hour early. A half an hour early because I like to, look through my charts, take my time, set up for at least the morning. So I set up all of my trays actually for the morning. Depending on the office you are in, you may not have enough trays per patient. It's hard to say, but I have at least 4 trays. So I do set up all of my trays in the morning. So I set up a Profi cup on my tray. I set up gauze, I set up a slow speed suction, and I set up a handpiece to polish. I put some of the polish on my tray too, and that's it. So that's just pretty much a basic setup for everybody. So then that way throughout the day, which happens all the time, if I'm running a little bit behind, I don't have to think that I have to take those extra few moments, which isn't a long time anyway, but still, when you're running behind, 5 minutes makes a big difference. So if I am happen to be running behind, then I can just take a tray that I have set up, put it on my counter, and bring the patient back. Easy. Whereas if you didn't have the trays set up, then you would have to go into the sterilization area, grab a tray, grab all of your stuff, bring it back. You may forget something. You would have to go back for something else, so it just helps. So that's another tip for you is please arrive early, especially if you're new. I would arrive at least a half an hour early. I mean, I say that because first thing in the morning, if you arrive, let's say 45 minutes early, there may be nobody there. And that has happened. There may be nobody there, but at least a half an hour early, there should be somebody there to help you. Because if you're in a new office, you'll need to know where you're working, who you can go to if you have questions. Like, can you go to the main or a dental assistant? Can you go to the office manager? Can you go to the dental hygienist? Like, who should you be talking to if you have questions, right? Because in my office, like we all work. So if a temporary or if a new person has questions, it's actually smarter for her or him to go to the person who is working in the sterilization area because they will have time to answer their questions. Whereas if they come to me as an example, I may have time, but I could also be 15 minutes behind, so I may not be able to help them as well as I could have, right? So I do say ask whoever is showing you around who you can go to if you have any questions. So the main things that you should ask them to show you is where your trays are, where everything is that you will need for yourself and for your patients. So the toothbrush, the toothpaste, where do they keep all of those things? Hopefully they will be in your operatory, so that's easy. but they could be in the back somewhere, who knows, right? Also ask, do they have digital x-rays or manual x-rays? Hopefully every office has digital at this point, but some actually, I've heard, still don't. But there's different types of digital. So do they have the sensor, or do they have the phosphoric plates? So you need to know how to use them. And if you are not sure, that's okay, but you have to ask, okay? There's nothing worse than not knowing something and not asking. And then when you have to do something on your patient and you're 20 minutes behind, and then it's like, do I just not do it? Or do I ask somebody now? So ask first. So let's say if they have sensors in their office and you've never used a sensor before for the digital x-rays, well, you need to know how, right? So it is very simple to ask a question, okay? And I'm hoping actually once you find out you have the job, you should be asking these questions actually first, the type of x-rays they have, how often they take the x-rays, things like that. Another question is, let's see, every office is different. I know in my office we stop giving fluoride age 14, where some offices it's up to 16. So I think and I feel that that's another question that you should be asking is who and when do you stop the fluoride application, and do you have the fluoride rinse? Do you use fluoride in the trays? The paint on technique, the fluoride varnish, every office is different, so I would ask about that also. And you should know, of course, where your charts are. Your schedule hopefully is printed out for you. And another question to ask is at the end of the appointment, do you bring the chart up to the receptionist and they do everything for you? Or are you expected to put any coding through? That's a question you should be asking also. Plus, as for the codes, so after each patient, you will need to know how to write the codes. And a good rule of thumb is to check the last, I'd say, entry or 2 or 3 and see what the dental hygienist or assistant did prior to that, because you don't want to overcharge and you don't want to undercharge either. A perfect example is we had a temp hygienist who was in our office who was charging half a unit of polish, but 2 units of scale. We always do a full unit of polish because we polish everywhere, and depending on how much calculus they have, we may do a unit and a half or 2 units of scale, maybe 3. It depends on the patient. But, if you're all of a sudden charging half a unit of polish and 2 units of scale, when the patient for the last 10 years has been getting a unit of polish and a unit and a half of scale, they may be like, what's the difference here? She's new, but that's not my fault, so why am I paying more? So think about the codes and think about the prices also, and know how to write in the chart, because again, every office is different. Some write a lot, some write hardly anything. So, do what's the most comfortable for you too, but you need to sort of have an idea if you should only be writing kind of the main things or everything down, because it does depend on the office. And check if they have a piezo scaler or an ultrasonic. Hopefully at this point you do know how to use both, because some offices have both, some have one, and some have neither, unfortunately. So hopefully you will not have to do only hand scaling, because that's tough, right? Another question, when it comes to the probes, is that something you do every year? And is that something you do on your own, or will you have an assistant to help you? And if you do have an assistant to help you, well, who helps you, and how do you tell them that you need help, right? In my office, there's a main schedule printed out. We have it in the sterilization area, and if we need a probe, we sort of put a probe underneath our patient's name so that the assistant who is working in that area knows to come help us. But every office is different, so check to see their policy. Hopefully the office does have an office manual. Not a lot of offices do, but I find that if you're able to read that first, that will help you a lot. Let's see. What other questions do most new graduates have? A big one seems to be, how do you know if your patient has arrived or not? A lot of offices do have hopefully a computer system at this point, and their name will either change color. There might be a check mark near their name if they have arrived, something like that. And you just normally have to go into the waiting room, call the patient's name, and bring them back. In some offices, the assistant will actually bring back the patient for you. So ask how they like to do things, but typically you are the one bringing the patient back. And typically, too, you are the one who does clean your own room afterwards and puts your instruments into the sterilization area. You may or may not have to physically sterilize them yourself, but typically you do put the instruments in a sterilization area for that assistant to help you. Or you may put them in a cassette into the ultrasonic at least, and then the assistant will do everything else from there. Check with your office. Let's see. Another question is, what do you do after the patient is finished? If they need a check, how do you let the patient know, or how do you let the dentist know? Do you just simply go into their room, say, hey, I'm ready? Probably not. Do you leave a note in their room to let them know? Do you let the assistant know who lets them know? In some offices, they physically change a color on the patient's name in the computer, and that lets the dentist know. So check how you let the dentist know when the patient needs a check. And keep in mind that not all patients will be in for a cleaning and checkup. Some could be there for perio. So if it's a perio case, then as soon as you are done the cleaning, then the patient's done. So keep that in mind too. We talked about the x-rays, so check to see how often they do typically take the x-rays. A good rule of thumb is to check back in the chart and see how often that they've had x-rays in the past. So you could do that also. We talked about how to write up the chart, so just check all of the previous notes. And some offices write in blue, some write in green, some write in black. So check to see the color that you are supposed to be doing it in. If there's any cavities or something to be done, typically you would write that in red. If you want to make a note stand out, it would either be highlighted, or you would write it in a different color, something like that. But let's see. Those are the main things that I can think of, because those were the main questions that people had. I'm just kind of checking my notes here. But if you are starting in an office soon, awesome. But let me know if you have any questions at all. And if it helps, I do have the dental hygiene manual. So it's not for dental assistants, but it's for dental hygienists. I do have a dental hygiene manual, the second edition, that is awesome and goes through everything, literally. So all the questions that you may have, literally everything. It goes through how to take x-rays, because that's so important. You need to know how to take x-rays. If you know how to take excellent x-rays, they will love you, trust me. So I go through how to take them in the paralleling technique and in the bisecting, very important. I go through things to talk about with your clients, with your patients. I go through a certain perio program, how often you should be probing. I go through if the patient, say, has minimal bleeding, heavy plaque, what should their next appointment be? If the patient has minimal bleeding, minimal plaque, minimal tartar, what should their next appointment be? So I literally talk about everything, because when I was a student, when I first started a job in a dental office 12 years ago, I had questions. I felt very overwhelmed and I didn't know where to go or how to start. So I am here to help you, and the dental hygiene manual helps huge, okay? And if you're a dental assistant, if you need anything, just email me, talk to me anytime. So I hoped this helped, and I will talk to you all very, very soon.